A win, right?
What's a few degrees difference make? I mean, come on.
I just watched a neck warmer yesterday because I thought I'm going to start wearing it when I run. You know, like a skiing neck warmer.
It's January.
Anything that works, right?
Neck warmers, body warmers, whatever works.
Buy those things,
Thanks, David. Still ahead at 5, our weekly focus on cancer.
We're going to talk with an expert on the value of palliative care, who needs it, and why there are new care standards.
Then at 5:30 on NBC Nightly News with Brian Williams. Brian Williams anchors live from Las Vegas as the Democratic candidates gear up to debate the issues of race, gender, and the economy.
NBC 15 TrueView Weather is brought to you by Kalahari Resorts.
They gave me a time of my death, and absolutely not. The nurses treat me just like any other person. They don't treat me like I'm dying.
Palliative care is one of the most incredible types of care when you or someone you love need it. It is pain management and quality of life care for someone facing a serious illness and at the end of life. But as Debbie Fetterman just said a moment ago, it is not just for the dying. Joining us today is Dr. Toby Campbell, a palliative care specialist at the University of Wisconsin Carbone Cancer Center, one of the experts we're actually going to be talking with routinely in our Look at Cancer every Tuesday right here on NBC 15 News at 5. Dr. Campbell, thank you for joining us today.
Absolutely. Thank you.
Palliative care. Explain what it is, because even in the studio here during the break, I mean, there's been a lot of discussion that there's just a really lack of understanding about what palliative medicine is.
And I think that's understandable. Palliative care is really an emerging field of medicine. Actually, just in 2008, we will become a formal specialty, just similar to cardiology or oncology. So an emerging field of medicine which really focuses on, in the most global sense, the relief of suffering. Whether that suffering comes from physical symptoms like pain or shortness of breath, or whether people have psychological or emotional symptoms, or whether the family is under stress. So really, whatever is the source of suffering, that's what palliative care wants to address.
And this is something that I think most people who do know about palliative care associate it with hospice. And this is something actually that the University of Wisconsin has actually taken on as a priority recently and opened up your own inpatient palliative unit. Explain that move.
Sure. So to take the first part, hospice and palliative care really have a lot of similarities. In the biggest sense, again, both really are focused on the relief of suffering. While hospice is a particular benefit and mainly takes care of people in the home or outside the hospital setting, palliative care primarily takes care of people in the hospital. It doesn't have the same limitations that the hospice benefit defines, such as a 6-month prognosis. We both focus on people who have some kind of life-limiting illness, who have some symptom or another. So those are the similarities, which for the most part is the case. The inpatient palliative medicine unit, which we just opened in October, I think is a really progressive move by the University of Wisconsin Hospital. Certainly places it amongst the very fewest number of hospitals in the nation in terms of its commitment to taking care of patients and their symptoms and any cause of suffering. And this is a place for us to really do aggressive symptom management. It's certainly not for everyone, but it is appropriate for the type of patient who has a serious illness and is really having trouble.
That was my next question, actually. It leads really well into that. What is the one thing? Again, I think most people associate kind of taking on palliative care as acknowledgement that they're actively dying. And that doesn't always need to be the case. You gave an example of someone who may have congestive heart failure. Can you talk about that?
So palliative care and hospice, while we take care of people who may be dying, we certainly aren't interested in hurrying them along in the process. Really, the idea is to try and care for those symptoms so that people can maximize the quality of life with whatever time is left. And we try not to, you know, sort of put an end on that. So if people want to talk about maybe what's coming, if they want to talk about dying, I think one of the unique features about a palliative care or a hospice physician is that we're willing to sort of open that door and talk about it. That can be pretty scary, but it's not something that we have to dwell on. Okay, we're going to continue this conversation much more in the coming weeks, months, and year, and we appreciate you being here today, Dr. Campbell. Thanks. Absolutely, thank you.
All right, we'll be back right after this.